This is Joanna Brightstein, and I work in global communications. I'm joined today by Dr. Mo Ali. Dr. Ali is Executive Director of Market Access. He's also a physician. Before joining the company, he served as part of the UK's National Health Service, and he was at the NHS in 2009 during the swine flu outbreak, serving as part of the response. When Dr. Ali saw the coming impact of COVID, he was once again called to respond. In light of the pandemic, our company has changed its volunteer policy to support employees like Dr. Ali with medical backgrounds, enabling them to be on the front lines and doing a lot of good for a lot of people. Dr. Ali, thank you for joining us.
Hi, Joanne.
Dr. Ali, how did you personally respond to the COVID pandemic?
Many of us take up the calling to be a physician because we're choosing to help people. We all live by that philosophy. And suddenly, in a moment of an unprecedented health emergency, society is calling on doctors and healthcare workers to stand up and be the shield. At that moment in time, there's a moral imperative. If you stepped away, who would be there for people? Who would be there for your loved ones? Who would be there for others if everyone took those decisions? And therefore, the right thing to do is to stand up for not just the people you care for, but for those who others care for.
How is the volunteer policy being put in action?
I think what the change in policy did for me was to offer the freedom and the permission to be able to go and offer help. And that's just me as an N of one. If you think as a pharmaceutical company, the number of healthcare workers and other people who've come to join this organization to help people, if you think about the untapped potential and to be able to release that in one swoop, I think was an amazing act. And it's one of the reasons why I'm proud to be part of this organization.
Of the many stories you have seen, what's one that you would like to share?
It's the breadth of help that's so useful. So if I give you an example of a patient who I saw today, I work within a COVID site where we're seeing COVID patients. This poor patient was someone who came in. It was a 6 or 7-year-old patient without any health conditions outside of this, deteriorating quite rapidly, needing oxygen. And in the melee of everything that was going on, with me trying to get him in onto a ventilator, with the nurse trying to get the oxygen onto him, the most powerful thing was the story his son told me afterwards when he was on the ventilator, which was the bit that made the difference. And the bit that I saw out the corner of my eye, but I hadn't made the association, was when you're having high flow oxygen, your mouth becomes really dry and you can't speak. And it was the cleaner who was coming in, ducking her head round, who saw that, which was something we all missed, and brought him a glass of water.
The world is facing a lot of challenges. Is there something that gives you hope?
Strangers coming to help people who are not related to them, to help the elderly, to help feed them, make sure they're safe. And the piece that I'd want everyone to watch is a contagion of compassion that's going across multiple communities across the world.
Thank you for joining us.
Thank you, Joanna.
And for listeners everywhere, thank you for joining us. Please continue to check back for more updates and stories of our company's response to the COVID-19 crisis.